foods really can slow down your aging. If you eat certain foods, you can live even 20 years longer, and I will tell you what these foods are, and I will tell you how. Aging begins after 25. Yes, that's correct. Before 25, the human body grows and matures, and after 25, aging usually begins. Of course, it's not about appearance, but about what happens inside. DNA starts to accumulate damage, and its repair gradually slows down.
It's like you begin to destroy schools and universities in your country. Knowledge doesn't vanish instantly, but the system that preserves and transmits it weakens. That's DNA damage. Cells slowly lose precise information about how to function, how to repair, how to renew. At the same time, mitochondrial efficiency drops. It's as if you're dismantling factories across the country, one by one, quietly, gradually. Energy production declines, resilience softens, output lowers, then hormonal peaks plateau and slowly fall. You may notice that interest fades, emotional intensity dulls, motivation softens. Not gone, just quieter, slower, less sharp. And cellular repair? Damage begins to accumulate faster than repair can keep up. It's like demolishing buildings faster than you can rebuild them, brick by brick, system by system, year by year. Over time, the country weakens. Over time, the body does too. At first, it's subtle, almost invisible, molecular, silent, internal. But years later, it becomes visible in the mirror. After 30, we already begin to feel lower recovery after poor sleep. We feel more fatigue, more exhaustion after stress, and less resilience to overeating or alcohol. At the same time, we lose muscle, we lose neurons, especially motor neurons. Fat starts to accumulate in the liver and muscles, and this process accelerates after 40 especially. Old and damaged cells accumulate, and they begin producing signals. Pro-inflammatory, disruptive, persistent, and low-grade inflammation develops. It's like when one poisoned potato begins to rot the rest of the vegetables, the surrounding tomatoes, the whole basket. Because of this, a person gets infections more easily, fewer immune cells are produced, and recovery lasts longer, slower, heavier. At the same time, skin texture changes even before wrinkles appear. Collagen is lost, hyaluronic acid is reduced, and the skin becomes thinner, duller, more fragile. Dark circles and tired eyes develop. It's not just lack of sleep, it's aging. But the good news is that we can change, not everything, but many things. Because the human body is designed to live around 100 years if we do things correctly. Yes, genetics has its role, but it is estimated that the genetic contribution is around 30%. It mostly determines the upper ceiling. Genetically, we may be set to live, in the best case, up to 120 years, but the rest, around 70 to 80%, depends on us, what we do, what we eat, how fast we decline, how long we maintain function. So, in other words, with a correct lifestyle, you can add up to 30 years to your body, to your lifespan. Here, I don't mean exceptions. Exceptions always exist: cancer, accidents, unpredictable events. But for most people, in optimal cases, it is possible to add up to 30 years. For example, if a person dies in their 60s or early 70s, it often means that this person lived with a poor lifestyle. Chronic strain, metabolic burden, cumulative damage. If a person dies in their late 80s or 90s, it usually means they lived an optimal lifestyle. And if you live to 100, it suggests a near-perfect lifestyle, consistent, disciplined, sustained. And if we ask what role food has, it has a major role. Food is a major player in determining our lifespan. An equal role is played by how much we eat, that is, food quantity, by when we eat, and by what we eat, meaning food quality. That's why we will talk about food that slows down aging. If we say, and if you should remember one food is a true superfood, it is extra virgin olive oil. It decreases all-cause mortality and lowers cardiovascular disease risk in many studies, and it is a central part of the Mediterranean diet pattern. You should aim for 2 tablespoons of extra virgin olive oil per day. Ordinarily, 1 tablespoon per day is enough, but if you replace other fats like butter, mayonnaise, or cream sauces, then you can use 2 tablespoons of extra virgin olive oil. Extra virgin means it is not refined. It should be packed in dark glass or a metal tin, and the taste is slightly peppery and bitter. It contains monounsaturated fats, tends to improve lipids, and reduces harmful oxidation. It has anti-inflammatory action, supports endothelial function, and decreases low-density lipoprotein oxidation, the so-called bad cholesterol. In other words, extra virgin olive oil reduces harmful components in the body and improves blood vessel condition, and blood vessels are among the most sensitive structures in the body, and among those that age fastest. Here is a simple rule. You can replace most fats with extra virgin olive oil. Best practice is to combine it with vegetables. The best timing is with meals. Use it raw, drizzle it after cooking, because overheating, frying, or reusing it many times increases oxidation products and reduces benefits. You can still use extra virgin olive oil for frying and replace sunflower oil or other oils. It's better, but the best situation is to avoid fried foods altogether and not use olive oil for frying. If you still choose to fry, yes, it is better to use extra virgin olive oil. It is better than sunflower oil. And remember, the worst situation is butter. During heavy heating of butter, more harmful compounds can be created. The least harmful and best option remains extra virgin olive oil, even for frying. Now, what to remember? Try not to exceed 2 tablespoons per day, because it is high in calories and may increase the risk of weight gain. Usually 1 to 2 tablespoons is fully enough. Also, not every olive oil is the same. Extra virgin means unrefined, and refined olive oil contains fewer polyphenols, so fewer benefits, and you should use olive oil for years. That is the key benefit and the key strategy. The second most important food is nuts. Regular intake of nuts decreases heart disease risk by almost 30% and significantly reduces mortality risk even in small daily doses. This finding is independent of body weight, independent of exercise, and independent of other foods in the diet. It means that nuts alone can add almost 5 years to your life. What do nuts do? They reduce inflammation, improve insulin sensitivity, strengthen blood vessel condition, and support gut microbes. They increase bacterial diversity, meaning more beneficial bacteria begin to grow. More diversity, more resilience, more metabolic stability. They are rich in polyphenols, rich in fiber, rich in alpha-linolenic acid, a plant omega-3. It is less potent than fish oil, yes, but still beneficial. They also improve satiety signaling, slow the glucose response, and support fat handling. If we ask which are best, walnuts and almonds are the champions. Hazelnuts are also very good. Pistachios are slightly less beneficial but still valuable. Walnuts lead because of their polyphenol profile, strong anti-inflammatory action, and brain and vascular benefits. Yes, they contain omega-3, though less effective than fish-derived omega-3, but their polyphenols and fibers are key. Almonds are nearly as effective. They reduce cholesterol, improve insulin sensitivity, and provide excellent vitamin E. Hazelnuts follow slightly behind. Pistachios and Brazil nuts also help. About peanuts, technically. They are legumes, not tree nuts, but still beneficial, just with slightly weaker longevity signals. They contain fewer polyphenols and a different fat profile, yet remain useful when the budget is limited, portions are controlled, and they are unsalted and dry roasted. The best method to maximize benefit is simple. Replace all processed snacks, chocolates, candies, chips, with nuts. Best timing is with meals or as a snack replacement. Intake them unsalted or lightly salted. But remember, whole nuts are key. Peanut butter or other nut butters do not behave the same. The benefits are strongest with whole nuts. Amount matters. Nuts are easy to overeat, so portion is crucial. The best regimen is about 25 grams per day. 1 handful, an adult palm slightly cupped. Above 40 grams, benefits plateau. More is not better. Moderation, consistency, control, safety points. Nut allergy exists, especially peanut allergy. If present, avoid completely. With Brazil nuts, watch for selenium toxicity. It can cause hair loss, fatigue, and nerve problems. Limit to 1 or 2 per day, not more. Generally, nuts are safe for teeth. They have low acidity and low sugar, so they don't directly erode enamel. However, very hard nuts can cause microfractures, and excessive chewing may irritate gums. Always crack shells outside the mouth. Don't brush immediately after eating. Wait about 30 minutes. And the third most important longevity food is legumes. They significantly decrease heart disease risk, help with type 2 diabetes prevention, and improve healthy aging markers. In all regions where people live longer, the so-called blue zones, like Sardinia, Ikaria, Nicoya, and Okinawa, people eat large amounts of legumes. This consistency matters because legumes can reduce all-cause mortality by almost 15%. They delay disease onset and can add around 3 years to your life if eaten regularly. The main mechanism is their high content of soluble fiber and fermentable fiber. They slow gastric emptying, increase satiety, and have a low glycemic load, which is best for insulin control. They blunt glucose spikes, reduce insulin resistance, and stabilize energy. Their fibers increase short-chain fatty acids, which are highly beneficial for health. They improve the gut barrier, support the immune system, reduce endotoxin leakage, and lower inflammation. Also, legumes modulate mTOR, an important anti-aging pathway, because plant protein with a lower leucine load activates more repair pathways and fewer growth pathways, a clear longevity signal. They also decrease cardiovascular risk and improve endothelial function. Recommended intake is about 1 cup daily. The champions are lentils, chickpeas, white beans, and black beans, though almost any beans are beneficial. 1 cup per day is ideal, but start slowly because gas can be an issue. Soak them before cooking. This early adaptation phase is temporary. Over time, the microbiome adapts, and bloating and gas usually decline. Combine them with extra virgin olive oil for best effect. Regular intake is key, daily or at least every other day. The fourth most important longevity food is fatty fish, like sardines, salmon, and mackerel. Everything we discussed before was plant-based, but fish is the strongest non-plant mortality reduction signal. The reason is simple. The fat is rich in omega-3, which reduces inflammation, stabilizes heart rate, improves endothelial function, and supports brain function. The best choices are sardines and mackerel because they are small fish and contain fewer contaminants. The best form is baked, grilled, or steamed, not deep-fried. The optimal regimen is 2 to 3 servings per week. Long-term intake is safe, effective, sustainable. The fifth most important foods are leafy greens, like spinach and kale, because they reduce vascular aging and fragility through nitrates and nitric oxide production, improving blood flow. Their folate content supports DNA repair. Best intake form is raw or lightly cooked. Daily intake is safe, effective, foundational. The sixth most important food group is whole grains, like oats and barley. They contain soluble fiber, improve gut bacteria, and lower insulin spikes. Oats and barley are especially effective. Intake 1 or 2 times per day. Remember, refined grains are not the same. They are not effective. The seventh is berries, especially blueberries and strawberries. They are rich in antioxidants and protect mitochondria. Intake 3 to 5 times per week is optimal. The eighth is broccoli because it contains sulforaphane, which activates repair genes and detox pathways. Eat 3 to 5 times per week. Lightly steamed is the best intake form. The ninth is fermented foods, like yogurt, kefir, and matsoni. They reduce inflammation, support the gut barrier, and improve microbiome balance. Choose plain forms without added sugars. The 10th is garlic and onions. Garlic contains allicin and has anti-inflammatory, antibacterial, and antimicrobial effects. Crush it and add it after cooking. Avoid heavy heating. Best intake is fresh garlic, about 3 times per week. Onions provide anti-inflammatory and vascular support through quercetin. Red onions are especially beneficial. Other supportive foods include tomatoes, mushrooms, coffee in moderation, green tea, apples, citrus fruits, herbs, and spices like turmeric, avocado, and dark chocolate. Each offers small but meaningful benefits, and when integrated into the daily diet, they reinforce the larger longevity pattern.